Good morning. Thank you for joining us today for today's master class on outbreak management. We'll take you through how to prepare your facility for a cold and flu outbreak. Leading us through today's master class is Barley Chironda, International Infection Control Specialist from Clorox Canada, and David Smith from Bunzl Canada, who is the Cleaning, Hygiene and Sanitation Director for Eastern Canada. Following the session, join us for a live chat where our experts will answer your specific questions. So as we go along, be sure to type your questions or comments in the chat box found at the bottom left of your screen. Now, let's turn it over to our experts, Barley and David.
Thank you very much for that introduction. This is a very important topic, I think, and very timely right now, especially that we're in the winter months and it could be on the brink, you could possibly be on the brink of an outbreak. So why do businesses need to plan for cold and flu outbreaks? Well, because they cost a lot more than you may think. And there's a couple of different statistics that we're going to go through over the next little while that will bring you up to speed in terms of what that could look like. So outbreak management is a key element of business continuity planning. The reason for that is Canadian workers miss an average of 9.3 workdays per year due to illness. And Canadian businesses alone lose approximately $1 billion in healthcare costs and lost productivity every single year. In addition, 1.5 million workdays are lost every year in Canada because of cold and flu. And just between the 2018 to 2019 flu season, which is already underway, we're noticing from Public Health Ontario that the flu season is yet to hit its peak. Last year alone, 302 Canadians died of flu or influenza-related complications. So, knowing all this, how do you keep an outbreak from taking over your facility? First off, you've got to have and start out with an outbreak management plan. This is the pre-work that is done before anything even happens. And there's 4 steps that you have to take to plan for an outbreak. So here are some of them. First off, you want to establish an outbreak management team. And I'll later on tell you who makes up that team, but you want to establish that outbreak management team. You want to conduct a risk assessment, determine how a flu outbreak might affect your facility, see what the potential impact could be of absences, and the control measures as well as the cost implications that can happen. Then you want to plan your communications. How will you communicate? How will you communicate within the members of the outbreak management team? How will you facilitate your internal communications so that you have preventative strategies being clearly communicated? Your sick leave policy needs to be well known, as well as any specific actions that are required. Lastly, you want to prepare for any unexpected absences. And this can be done and is a critical step if planned appropriately. You want to establish a flexible sick leave policy to minimize the risk of transmission. And as I mentioned earlier, there's a whole bunch of people that you need to have as your outbreak management team, and they are listed and stated below. And you might have some flexibility depending on your organization, and we'll go into specific strategies related to your particular organization. Well, despite your best efforts, what happens now if your facility is now experiencing an outbreak? And we're going to talk about that in the next couple of slides. First off, there are 5 critical action steps that you want to take. You want to first off confirm that you actually have an outbreak. And this is an important piece because you want to verify the number of illnesses related absences and if they meet your outbreak criteria. You want to verify a diagnosis, right? In some settings that can actually involve getting lab results and making sure that it's actually a flu, and that differs by setting, and we'll go into specific setting related interventions. If not, you want to also monitor for similar symptoms related to illness, and this is an equivalent way of compensating for if you don't have lab-related testing. You want to set up a case definition, and a case definition is important because that's really a way to actually determine the type of illness, the location of suspected exposure, the time of exposure, and the symptoms, and is a key way to actually identify who's at risk. Fourth, you want to implement control measures. And this goes about educating on your hand hygiene, coughing and sneeze etiquette, and ensuring the proper use of personal protective equipment. Then you want to also ensure you have the enhanced cleaning and disinfecting of common touch points. An outbreak is not complete without surveillance, and surveillance is important because that's your way of monitoring for signs of new cases and assessing how well control measures seem to be working. So that's something that you definitely want to do as it's key. Last but not least, you want to make sure that you implement your control measures, because this is the most important, and this is definitely key as part of any outbreak management process. So I'll pass it on to Dave now because he'll speak to specific strategies as we spoke about that there might be different strategies by location.
Good morning, everybody. So the first one we're going to touch on really encompasses healthcare, but we've made it site-specific for long-term care. So there's really 8 steps in the long-term care environment to help mitigate an outbreak. Phase 1 is really involving us in taking some action, and we have to establish a preliminary outbreak case definition, as Barley spoke to in the last section. And if we suspect an outbreak, we need to be able to identify it. And signs and symptoms of an outbreak are key. Where and when the symptoms start, and from a residential standpoint or staff location in the home. All critical pieces. You obviously need to implement general infection control measures and make sure your staff are aware where all the PPE and the necessary materials there are available to them readily. At this point, you may declare the outbreak and notify the local medical health officer. And then the next step of this is to assemble that outbreak management team that's so critical to help you put this down in the facility, and the communication begins. And it's communicating the results of potentially the lab tests that with the staff, so they're aware of what's going on. The health units will be notified of the results of the influenza and the tests and what type it is, and are responsible for notifying the facility's infection prevention and control professional, so we can deal with these things. And how do we implement an outbreak management strategy in our environment? And monitor the outbreak, monitor the outbreak on an ongoing basis, including identifying the new cases, monitoring ill residents and staff, assessing the controlled measures. We also will declare the outbreak over when it takes 8 days after the onset of symptoms from the last resident case to consider the outbreak over, and that's a critical piece, the time involved. Complete the outbreak investigation file and put a final report together that summarized the outbreak management. And remember, it only takes 2 cases in 48 hours to signal a possible outbreak. Now we're going into the site-specific management of post-secondary education, or college, university, K-12 it also applies to as well. We're going to be cleaning for health in this area, but as well, we also clean for appearance. We need to provide proper training for staff. Educating staff on the correct usage of the materials will always help improve your cleaning quality and the outcomes. Use the right cleaning equipment for the job, so it's critical that you use a proper disinfectant for that, a DIN registered material, and then color-coded cleaning materials if you're working from a system, which also will include microfiber cloths that help avoid cross-contamination. That's where certainly color-coded systems come into play. You want to pay special attention to the common touch points or contact points during the cold and flu season. Studies have demonstrated 50% reduction in illness-related student absenteeism when these areas are disinfected or sanitized on a daily basis. And try cleaning and hygiene innovations such as our electrostatic disinfecting, which we've had enormous success with in all of the areas that we're talking about here today. The next slide, I'm just going to give you an overview on it. It discusses your normal routine cleaning practices versus how you have to ramp things up with outbreak and cleaning frequencies. And again, it may involve additional materials, additional staffing, but these pieces are really critical to ensure that you put this outbreak down as quickly as possible. And again, this chart will give you some guidelines on how you may want to ramp up your cleaning and the areas that you want to concentrate on initially when there's signs of this. Okay, now we're going to move on to the piece that deals with both government and correctional institutions. This is an area where we've had a lot of experience and success. We've developed a 9-step program here to minimize the spread of infection in correctional facilities. And again, they certainly have their challenges. We need to be able to isolate ill patients in an infirmary or a designated area from that standpoint. Pose unique challenges for our outbreak minimum management due to a number of factors. high staff and inmate turnover is always an issue. Sometimes there can be limited hand hygiene resources and also related lack of PPE in those areas. A number of these facilities are very old and have poor ventilation and HVACs at times, so that also adds to the problem. And then there's a high volume at times of inmate movement, and it also intensifies the risk and allows for transmission between areas in the facility. And there's always that other common piece that you need to prioritize security over some of the healthcare initiatives in this area. And we want to look for the inmates with symptoms. We need to be able to identify those: sore throats, muscle or joint pain, and low energy. So, as I mentioned earlier, we've developed a 9-step program to minimize the spread of infection in correctional facilities. One is to isolate ill patients in an infirmary or a designated isolation area. We need to initiate contact precautions, again with the PPE and gowns, gloves, masks, and sometimes eye or face protection. Shields are quite common in this for staff and who interact with the inmates. You need to notify the site immediate care program person, so the ICP, and you need to encourage patients and anyone who enters into the cell in those areas affected to wash their hands. Hand hygiene is always a critical piece. And you need to dedicate to the individuals affected only the certain pieces of equipment that are going to be in that particular area for them. So it's dedicated to that patient. Used to the 2-step cleaning method, as we like to call it, with hospital-grade disinfectant cleaners. So we're cleaning and disinfecting. That's always, again, a most critical piece. You need to contact, continue all these precautions, if you will, for about 5 days from the onset of the illness, or until the patients are fever-free or symptom-free for about 48 hours. This also, we found we need to enhance the surveillance to monitor for other signs and symptoms, because it can go rapidly through a facility like this in a very short period of time. So we want to contain it. And we need to consult with the other healthcare workers for other symptoms, and again, that's the whole communication piece. And one thing, there are non-immunized staff in a lot of facilities, not only corrections. It's really critical that you get the necessary shots, including your flu shot, which I know there's a lot of great debate on it, but it's there to protect everybody. And then the last piece, and certainly still one of the most important ones, you need to amp up or raise your level of cleaning and disinfectant in areas such as any of the general common areas, the bathrooms, any things that are shared, because they're going to be points of transmission. And again, to put it down, we really need to focus on those. Okay, we're going to talk a little bit about BSCs and some site-specific outbreak tools that they can use as well. So we really want to, it's an opportunity for BSCs to enhance the quality and service that they're providing to their clients. Service enhancements ensure customer facilities stay healthier longer, and it also results in increased revenue for the BSC, but there's a lot of value in it for the customer. So you can offer service add-ons like electrostatic disinfecting, which will help to keep some focus on the high-touch cleaning areas that are critical in those environments. Again, encouraging hand washing in offices by the distribution of education material, hand washing guides, hand sanitizer, certainly at the start of the cold and flu season, but year-round is critical. Provide daily cleaning to the break rooms, the washrooms, the door handles, the key contact points or touch points, as we like to say. Stocking offices with the appropriate disinfectant wipes also has been proved very effective, because it will encourage the office workers to do their own on-the-spot sanitizing, if you will, of their work area, and that certainly helps in these situations. And then again, one of the areas we touched on a little bit, but our electrostatic disinfectant program has proved highly effective in all these areas we're talking about today, in corrections, in long-term care, in education. We've had significant wins where we've been able to put out norovirus and a number of other things very quickly with the addition of the equipment. So it's a huge innovation in this space.
So one of the best ways to contain an outbreak is also one of the simplest ones, hands down. And as you might be able to tell from the hands down, it really goes about hand hygiene. And here you definitely want to raise the bar on hand hygiene, especially in an outbreak setting. And you do that by a couple of ways. But one of the things you want to do is educate your staff on hand hygiene and the best practices. You want to make sure that proper hand washing is being done. And that can be done two ways. One with soap and water, and then that needs to be done by appropriately following the instructions of the 20 seconds that's required. The second way is you want to use a hand sanitizer, and that can really be done well if you have your hand sanitizer strategically placed in all the right areas so that when people need it, they have it really close to them. You also want to have coughing and sneezing etiquette and proper respiratory etiquette at every single point in time. And the way you do that is by covering your mouth and nose with a tissue, throwing out those tissues, and making sure that you cough or sneeze into a sleeve and not your hands. In the event that you do contaminate your hands, you want to make sure that you wash them. And because there's so many things that you have to remember, there's an option to also download a free hand washing how-to guide that can help you remember all the key things that you have to do around your hand washing. In addition to that, we talked about gloves and the disposal of those. There's very key things that you want to do. And as you can tell from the very cool animation here, it really goes into emphasize all the key steps that you want to do. But the key principles and tenets that you have to take away from here is do not touch the outside of a glove with the clean hand or with the unexposed hand. So you want to make sure that you make a ball of your glove and then you discard it. And then the last step, which is critical to this whole process, is the hand washing piece. And with that said, I'll pass it on to Dave so that he can actually speak to you more about the differences between cleaning, sanitizing, and disinfecting your facility.
This is an interesting and often misunderstood discussion on the difference between cleaning, sanitizing, and disinfecting. So I think it's a critical piece to go over in understanding how we're going to combat things. So certainly cleaning is a key element of disinfection. The first thing we have to do is remove all the visible soil, the biofilm, and debris from an area, and we need to do that before we can do anything else. It's the first step. Quite often people will take a disinfectant or sanitizer and they will just spray and wipe an area, and they're under the assumption that they've disinfected it, and then clearly that's not the case. The first step is to remove that soil before we want to sanitize and disinfect. We can, once we've done that, we can take the sanitizer and we can wipe down an area, and again, usually a lot of it has to do with the dwell time or the contact time, but we're usually looking for a 4-log reduction where we're reducing the bacteria to a safe level, and we want to do that certainly daily in education and long-term care, some areas we talked about earlier. And again, this is a process that's commonly used in food prep areas. And again, it's important to make sure that your food grade sanitizer is also CFIA approved, so it's government approved. And then the last piece, the second step after the cleaning happens, the key thing is once you remove the soils, you need to use an appropriate DIN registered disinfectant to eliminate the pathogens and bacteria from the surface to get that 100% kill. And the key thing that I always want to reinforce with people is please make sure that you understand what the dwell or contact time has to be, okay? And if you can do that for these high touch surfaces, you're really going to cut down on the likelihood of transmission. So one of the other areas and tactics that we've been very successful, and we touched on it briefly in a couple of slides, for all these site-specific environments we're talking about here today, we have a really good overall solution, and that is our electrostatic disinfecting. It allows us to get to some of those critical areas that we might struggle with to clean. In a long-term care, it may be personal curtains. In an office environment, it may be computer and desk areas. There's a whole bunch of things that we can do with this technology, and it's been highly successful and allows us to go in a matter of seconds and minutes and apply disinfectant to all areas in a space at an incredible rate of 18,000 square feet per hour. And I have a list of testimonials and very satisfied people as long as my arm, for colleges and universities and long-term care and government and corrections, all doing great things every day with this technology. So if you have any interest at all, there will be a way to reach out at the end of this so you can refer to the difficult cleaning areas, reference to the difficult cleaning areas like keyboards. There, as I say, we're getting fantastic results just by sanitizing with this equipment, let alone what it's doing when it disinfects. So again, we'll get into more specifics should you be interested in that and come out and bring it to site. So with that said, I'm going to turn it over to Lindsay, please.
Well, thank you, Barley and David. We know that was a lot of information for everyone to take in, but don't worry, we'll be sending you a link to this presentation and a copy of our comprehensive outbreak management guide to your inboxes next week. So watch for that. So now let's move on to our live chat. If you haven't had a chance to type in your questions to the chat box found at the bottom left of your screen, you still have some time to do so. If you joined us on our previous cold and flu prevention webinar, you'll remember we had some questions that we weren't able to get to in that time frame. So for everyone's benefit today, we'll keep going until we've answered all your questions. So our first question is, can you discuss when it is best to use disinfectant wipes, bottle and trigger, fully soaked cloth with a disinfectant versus electrostatic? Who wants to take that?
This is Barley. I can start it off and then I'll punt it off to David. I think when you have an outbreak and you have a pathogen of concern, you always want to make sure that you are selecting disinfectant that's got a the DIN number. So that's the bare minimum in terms of what that looks like. Once that is established, you want to also understand, as part of that outbreak investigation period, what pathogen you're dealing with. If you're dealing with a pathogen that is sporicidal, that is more difficult to kill, that also comes with its own requirements. As a result, that can help you decide what you want to do. Secondly, you want to decide on the placement of your outbreak, whether you have dilution systems, whether you have access to ready to use, what environment you're actually disinfecting, because by deciding on that, it will now make you be better positioned to decide what you can use. Just like you use hand sanitizer instead of soap and water, it's a decision based on your infrastructure and what you have access to. So when you're looking to make a decision about disinfectants as well, you also want to make decisions on what you have access to. So if you don't have infrastructure for dilution systems, then ready-to-use wipes are definitely the best way to go because they allow you to mobilize very quickly. In terms of like when to use the electrostatic disinfectant product, as we spoke about, coverage is a complication. So if you want to get to every nook and cranny and you want to get to that nook and cranny very fast so that you can reduce your outbreak, in that case, it's highly recommended to go with your electrostatic for those reasons. But I'll punt it off to David in case he has anything else to add.
Well, Barley, as Barley's done a very good job of, he's broken it down, and really it's about the tools and methodology that are available in your particular facility. All those formats have merits if the proper protocols are followed. If we don't, in some cases, as in dipping with microfiber out of a bucket system, there are some inherent problems that can cause you some difficulties, but that would be specific to the site. What I would add in the end is that with the use of electrostatic disinfection at the outset of an outbreak, we've been very effective in putting it down all in the space of 48 hours or less, and that's cases of staph infection, that's cases of noro outbreak, it's been cases of a number of things. So it's one that augments things very effectively, and it's part of the, I think the key thing, it's a part of a bundle there. I think Barley would agree with me. It's part of a bundle approach that you have to do to reduce that infection in your facility at that time.
Great, thank you. Okay, our next question. Can you discuss the difference between rhinovirus, the common cold, and influenza virus in terms of disinfectant activity, especially if using store-bought disinfectant wipes versus healthcare disinfectant wipes?
So that's an excellent question, and I think it really speaks to the complexity of the flu season and what you have to think about. When you really think about it, influenza and rhinovirus, you're now speaking to specifically the pathogen or the virus that you could be dealing with. Under influenza, there is a whole strain of viruses. That's why you have to take your flu shot every year, because those viruses change. That being said, some of those flu viruses are more difficult to kill. As a result, there's specific disinfectants that you have to go with. When you're talking about the rhinoviruses, it falls in the category of the cold and flu type stuff, where sometimes it might not have the same difficulty to kill as similar to influenza. As a result, regardless of what you have an outbreak on, you always want to work in collaboration with your infection control specialist, or work with your Health Canada in terms of products that are actually approved to kill those particular pathogens. As a result, the key thing here, to sum it all down, is you have to have a product that is a DIN number and that is actually approved to kill viruses that actually cause colds and flus, and then you also want to make sure that that has got the necessary approval required.
Great, thanks, Barley. In schools, are there any concerns about the residual disinfectant on toys and play areas?
I can speak to that. Again, as Barley's touched on, it's critical to look at your DIN registered disinfectant and any of the recommendations that you need to follow with the disinfectant that you're using. So in some cases it may recommend that an item be washed down after with potable water, or be rinsed in some fashion. Largely as a whole, though, on a broad term, there has not been any issues with disinfectants from a residual standpoint in a daycare area or a kindergarten environment. As a rule, if good cleaning procedures are followed, it doesn't become a problem. But when in doubt, you always need to refer back to the manufacturer and the label.
Yeah, and I'd actually add to that to say, if you have an outbreak and it's got norovirus or an influenza outbreak, what you might have to balance is the direction that you also get from your public health authority. And you will notice that in most cases they will really be more particular about eradicating the outbreak than the concern around some of that residue and the post work that's required. So you really want to be particular about bringing the product and the chemistry that works to reduce the spread and the existence of those pathogens on that particular surface.
If someone sneezes or coughs into the air, how can it transmit?
First off, bless you. But if somebody does sneeze, the way it actually spreads in the air is by airborne and droplet propagation. So that's a fancy way of just saying when the virus is in your body, it looks for ways to get out of your body so that it can continue to spread to other people. By that means, when you actually sneeze, it actually forces it further than the normal distance that would be required to actually contaminate someone. So when you sneeze and the droplets are lingering in the air, then somebody can actually breathe those same droplets, or they might land on a surface and then somebody might touch those droplets, and then because of the hand hygiene and the respiratory etiquette being wearing a mask and so on, you might actually now bring those viruses and pathogens closer to your face and thus into your body. So when somebody actually sneezes, as we spoke about, the most important thing is that respiratory etiquette. So you want to make sure that somebody sneezes and coughs into a sleeve so that you actually prevent that whole propagation. But last but not least, that's where the hand hygiene comes in really into effect, because you break the transmission when you actually touch surfaces that have had the droplets land on them.
Great, thank you. Our next question: if the Clorox bleach wipes are left open, is the efficacy of the sanitizing wipes affected? If so, by how much?
That's a great question, and I think ultimately, as per the manufacturer's recommendation, the cap, the lid of the wipes needs to be closed. That being said, there's also some engineering to the canister of the container that actually has a phalange or a tightness around it that prevents the wipes from also drying. So if you pull the first one and it's dry, I would say pull to the second one. Ultimately, there's always extra liquid within the container that allows a wicking effect. So 2 wipes pulled in, you might actually get to that wetness. But in actual fact, the only date that you get for your wipes is the expiry date, and the expiry date of bleach products, particularly Clorox-based ones, is up to a year based on from the time that it was manufactured. So as I say, the key thing is pull to the second or third wipe until you get to that wet one, and then you should be fine.
Great, thank you. Is the 360 disinfectant sporicidal, and can it be used for C. diff outbreak?
Okay, another very good question, and the answer is no, it is not a sporicidal. It does not have a claim for C. diff at this point. I don't want to give secrets away, but there is technology in development that eventually will go through the platform that will be suitable to use on an envelope virus and be a sporicidal. We just don't have it registered here in Canada at this point yet, but be patient, it is coming.
Does the electrostatic disinfecting applicator work for wheelchairs, headrests, cushions, etc.?
That's actually where we sort of cut our teeth in the industry, was on mobile medical devices, things that become challenging to clean, wheelchairs, IV poles, fabric, where you can only get a sanitizing clean, but on things that were a challenge to clean under traditional environments, and that's where the equipment is highly effective. I should add keyboards as well too. That's always a biggie, because when was the last time they were cleaned?
Absolutely.
Is H1N1 virus to be treated differently than regular influenza or norovirus?
So that's a loaded question, and I say loaded from a perspective that I think if you're looking at influenza viruses, they have their own thing. So H1N1 will fall under those influenza viruses. Under that, there's a set of instructions. Norovirus alone also has a set of instructions, and I'll break it down by just simply saying this. When you're dealing with your H1N1 and other influenza-like viruses, you would have to use a product that has the clearance to actually kill those particular pathogens. When you now get to norovirus, it becomes another different complexity. The challenge with norovirus is it requires very little to cause people to be unwell. As a result, it requires a little bit more attention to making sure you cover every single nook and cranny. With that being said, when you're looking at your norovirus, not every single product or disinfectant that kills influenza viruses will kill norovirus. So at the end of the day, you want to be really looking out for any DIN registered product to see if it actually calls out the ability to kill norovirus. And I think the electrostatic T360 does kill norovirus. The bleach-based wipes do kill norovirus, but certain other quad-based products will not kill norovirus. So you want to be looking out for that, especially when you have a norovirus outbreak.
With electrostatic sprayer systems, are there any respiratory concerns related to aerosolization of cleaning solution?
Another excellent question, and I guess it would be an easy assumption to have, but in fact, the electrostatic applicator is not aerosolizing any product. It's not fogging, spraying, or misting things into the air. It's a term they call induction charging. It's giving that chemistry a negative charge and a force of attraction. And in fact, other than when the person is actually applying it, where they're wearing the required PPE of an N95 and goggles and gloves, as we recommend, once they've immediately completed that process, they can take off the PPE. There's immediate re-entry, which makes this system very unique in comparison to some of the other things that are trying to treat areas, not necessarily with similar technology, but achieve the same result. You can immediately reoccupy this space, and there's all kinds of supporting information that clearly show there's no danger and there's no issue of breathing in disinfectant, which we wouldn't want to happen to anybody, clearly.
Absolutely.
For sure. Before electrostatic unit is used to disinfect large areas, is pre-cleaning necessary? How is this done? A spray and or wiping only?
Again, outstanding question. It goes to that whole slide we had on cleaning, sanitizing, and disinfecting. Pre-cleaning, or the first step, is always critical in removing the organic soil and the material from the surfaces. It's critical that we do that. Otherwise, we're not disinfecting, right? So that's the first piece. Then once you've cleaned that surface, by applying the 360 and the T360 chemistry to the surface, you are in fact disinfecting in a 2-minute span. It has a full 2-minute broad spectrum kill on its claim for all those surfaces. So it's a critical piece when you're trying to disinfect the surface. The methodology, how you do that, really, again, depends on the resources you have available, what your cleaning protocol is, or the BSC's protocol is for cleaning and disinfecting, and you'd have to break that down individually. But all those systems have merits. The key thing is to do the pre-cleaning first before you disinfect.
Next question, will I reduce my overall chemical consumption by using electrostatic technology like the Clorox T360?
100%. I utilize the technology for the better part of 6 years now here, and as we've learned, it reduces over traditional methods. So if you were working from a bucket system with microfiber, or from a flip cap, or a spray bottle into your cleaning cloth, whatever it may be, you're going to use roughly 65 to 70% less chemistry than if you were doing it a traditional method. And what's a better story, right? It's better to use less chemistry in our environment where we can.
Can you comment on the effectiveness of ozone cleaning systems?
That's not something I'm personally familiar with a great deal. Barley may have a...
Yeah, so I think ozone systems are actually, ozone cleaning systems are based on the same premise as hydrogen peroxides, where it's really looking to oxidize and kill using oxygen. So the challenge with oxidative chemistries, particularly depending on how they were made, is they quickly degrade. So unlike where I say, for example, that your bleach can stay for 1 year, your Clorox T360 solution can stay up to 4 years. The oxidative chemistries typically they degrade so quickly that sometimes you actually have to replace the liquid every single day. So depending on what solutions you have, what you will notice the most is that they quickly degrade from the time that they're actually made and available.
My next question here is, how would electrostatic charged particles wrap around non-metal surfaces? Does it not have to be a metal surface for this to work on wood, plastic, curtains?
No, and the induction charging will wrap around all those surfaces just described, and will fill up the plane of those surfaces. Certainly, the less non-porous the surface is, it makes it more ideal. But from that standpoint, it will wrap around wood and plastics and all those things. I'm more than happy to discuss the science specifically with anybody that wants to see it firsthand.
And we have a question here, what is the best hand sanitizer on the market and why?
I'm going to jump in here and say, the key thing is to use the 70% plus alcohol based sanitizer, and the one, regardless of whose brand it is. I don't want to get into brand specifics here today. It's really about a share of education and information. But I think the other key thing is, keep in mind, hand sanitizer is not a replacement for hand washing. I think Barley would agree with me. The critical piece is to wash your hands. Hand sanitizer augments a good hand hygiene program.
And I think just to add to that, I think just from where you left, Dave, I think you're absolutely right. I think the hand washing becomes the most critical piece. There's certain things that to date we haven't found fixes for hands. We haven't found fixes where hand sanitizer can be the only solution. So C. difficile is one where you need to actually get to soap and water. Norovirus is another debatable one where it seems like we need to get to soap and water. And last but not least, if your hands are visibly soiled, regardless of the caliber of the sanitizer, you still need to actually do that pre-work.
What is the biggest mistake you see facilities making when confronted with an outbreak?
So I think there's a couple of things that I see from some of the work that we do. I think as we establish, right, and I think you want to go back through to the material, and the slides will be shared, so the slides will be available. But you want to make sure that those 7 steps of outbreak management are clearly landed. And anytime you don't execute those 7 steps, it's a problem. One of the big things I see a lot is people don't actually verify that they have an outbreak. So when you don't verify that you have an outbreak, and you don't know exactly what outbreak you have, you start down the rabbit hole of looking for different solutions, which ends into a problematic situation, because then you get to the end and you really don't know whether you've got the right solution. Last but not least is the failure to actually sit down after the outbreak and say, hey, listen, what worked? What could we do better, and how to spread that out? But I think the best way to do is look at all the material that has been shared today and look at any of those key steps, because any of those can be a place where you can mess up.
And is there any benefit of shutting down a facility for the day to do a deep clean if there is a rapid outbreak?
Well, I guess there could be deemed an ability if you can ever sit and shut an area down to clean it deeply. There's an advantage to that, but the reality of the spaces that we work and live in, it's not a very practical thing. And so, really, from that standpoint, if you're following some of these critical steps that we're talking about and doing some preventive things that we covered off in some of our last work, you are able to identify when these things potentially are going to be problematic, and you can adjust your cleaning protocols and your procedures and ramp them up and hopefully contain them in a very short period of time. But I don't think it's a very practical approach to be able to shut down a facility. We can't seem to operate in that time and space in a day-to-day basis.
And I think just to add to that, Dave, I think one of the things that we've noticed even with schools and various areas is they might temporarily close, not shut down for the whole day, but they might decant certain classrooms and allow you to go in with an intervention. And the beauty about certain interventions that we've talked about today is they cover large areas and they're super fast.
Yeah.
So that's really what you want to be able to do, because you can't really, to his point, shut down a hospital necessarily or a school or certain other places. You need to keep them open. So having fast interventions is helpful.
Yeah, and again, I don't want to hype on electrostatics too much, but I would say you can go in and you can do a 35,000 square foot school in a couple of hours. So if you do that in off hours, to Barley's point, you can effectively cover an area very quickly.
Great, thanks. And I think this might be our last question. How can I get my commercial office customers to understand the value of doing those extra cleaning steps at this time of year when they are so concerned about cost?
It's certainly a challenge, and in property management, and especially at BSCs, we've been working with some people to try to get people to understand the value of that. The reality is that we've given you some numbers here on the costs involved with sickness here in our presentation, and there certainly isn't a cost attracted to that. So I might add, don't come to work when you're sick. It's the old adage of picking yourself out of bed while you have flu symptoms, and you're not doing anybody favors by going into the office and sharing with people. But back to the question in terms of the BSCs, it has been a struggle to get people to understand the value of an add-on, but we're working to try to educate them in that and making them aware that some of these innovative solutions can be added and they can ramp up and utilize these things. I've seen people now utilizing some of these technologies on a daily basis, and they've integrated into their system, and it's actually helped to their productivity and their results. In short, we can give them the facts and ask us for the info that we could help have that discussion with them for you on your behalf.
Well, thank you, Barley and David, for sharing your expertise on this subject. If anybody has any other questions that come up, please feel free to reach out to us. We would love to answer those for you. You can contact Stephanie Rochon. She is the one who sent you the invitation for this masterclass. So just reply back to her with your questions, and she will make sure that those get forwarded on to the appropriate expert to answer those questions for you. And as I'd mentioned, a copy of this presentation as well as our comprehensive outbreak management guide will be sent to your mailboxes next week. Well, thank you everyone, and enjoy your day.